Hello, my name is Dr. Thomas Davis. I am the president-elect for the Southern Pain Society. I would like to invite you to our March 12th and 13th virtual conference for 2021 entitled Perspectives, Concerns, Options for Managing Pain. We have an excellent line of speakers and clinicians, and I had the good fortune to recently interview one of those clinicians, Dr. Arnuad Versluys, originally from Belgium and trained in Chinese medicine, who will be giving a lecture on acupuncture and traditional Chinese medicine, specifically herbal medicines. He'll also be doing a case presentation with Dr. Jonathan Cole. I had the good fortune to interview Dr. Versluys recently, and I'd like you to listen to some of his comments that he will be speaking about in our upcoming meeting. Thank you very much, and I look forward to seeing you on March 12th and 13th.
Can you tell us a bit about your experience, especially in the United States, using acupuncture and traditional herbal medicines, Chinese herbal medicines for pain?
Yeah, absolutely. I mean, obviously pain presents itself in a lot of conditions, whether they are internal medicine conditions or musculoskeletal conditions. And so as practitioners of Chinese medicine in the US or in the West at large, we're kind of general medicine practitioners. You know, the trainings are fairly broad, and the field, the profession is not really at a level of maturity where there's a whole lot of specialization going on. And so when patients come to us, they'll come to us with a variety of conditions that could be ranging from, pediatrics to gynecology to musculoskeletal, orthopedic, it could be a little bit of everything. And so we because of that, we get a broad exposure to different types of pain, different types of conditions. And then, of course, some conditions lend themselves a little bit better to acupuncture treatment, better response with acupuncture. Some conditions, it's also good to incorporate some herbal treatments, especially, and I'll try to talk about that a little bit in my talk. Especially when it comes to issues of the internal organs or issues of what I would call more of a chemical nature. The herbs also are a very viable option. And so, unfortunately, because also, the hot topic nowadays is also using alternatives to, for example, opioid treatments. And so that's also something that we get confronted with a lot when people who have been on certain medications for a long period of time and are displaying certain negative effects because of that as well, that they're seeking further options in maybe reducing their pain medication and just reducing their pain using non-pharmaceutical means. And so, when it comes our way as an acupuncturist or as herbalists in the US, we get a pretty broad exposure and a lot of opportunities to work on these things.
I think that's one of the aspects that's so important, is that the suffering can be relieved in so many different ways, and that you can offer one realm of hope that some persons may not have thought about. And so I think that's one of the nice things about what you can offer in addition to our traditional Western approaches, which are so varied as they are.
That's right. Yeah.
And so what makes this such a timely topic? And I think you brought up some of the opioid issues there and approaches that you may have that are different than our traditional Western approaches.
Yeah, I think the Chinese medicine approach to pain, I know it's a total cliche when we use the word holistic, but it is truly a holistic approach in that we try to look at the total picture, which means we might even have to work on organ systems that might not even be really related directly, at least, to the patient's specific pain, but nevertheless might be contributing to their overall lack of well-being and well-feeling. And so when we take a more globalized approach, the pain reduction is also often part of a general improvement in vitality, well-feeling, well-being, both physically as well as mentally and emotionally, since Chinese medicine is one of those medical systems where there never truly has been an attempt to separate mind from body. Like I would even almost say that the whole mind-body medicine label is almost a misnomer when applied to Chinese medicine, because they never actually even considered there to be, it was so natural to not consider that to be separate. They believe in their medical system, in their theories that they've developed, that every organ produces a certain emotion. And so if you have a predominance of a certain emotion, and one could be, lack of joy or excessive presence of fear, and those things could also, in our modern society translate into, for example, depression or something like that. That could also contribute to a patient's just heightened awareness of discomfort and pain. And so working on it holistically provides a lot of extra avenues in relieving pain. And then, of course, tied to when we need to look at people who are struggling with opioid addiction or side effects from pain medication. It doesn't even have to be opioids. I mean, sometimes even just people taking Advil on a daily basis, having stomach problems, digestive issues, peptic ulcers, whatnot, being able to bring about a better total sense of well-being on every level, in every organ system as much as possible, contributes greatly to people being able to kind of at least moderate, and depending, of course, in good positive cases, you can even eliminate certain medications, but at least lower the required amounts that they take on a daily basis, and so having less occurrence of side effects. So it's something that we deal with a lot in that respect. And so I think of course, on a philosophical level, with the ever evolving technological aspects of our medicine, it also, brings us a little closer to, sometimes the repertoires, we're starting to really explore the limitations of the conventional tools and the conventional repertoires. Of course, there are on an ongoing basis also new developments and new discoveries being made, but still the tools in our toolbox, sometimes you do get at your wit's end with them. And so then often people come to us and say, what else can I do, because I'm kind of like with my back against the wall using conventional means, and so that's when we sometimes come in. Now that also is sometimes also really tough for us, because people come to us not necessarily, like in China, maybe a person might use Chinese medicine as their primary line of defense against illness. But here, that's not necessarily the case. People are used to going to see their regular doctor and following the regular protocols. And so sometimes by the time they get to us, we might be dealing with conditions that are far along. And so our chances of having a large improvement might also be a little bit limited by that. But I still believe that, considering all that, I feel we have a really good, productive place in the healthcare field in general.
So it may even be beneficial to involve you a little earlier in the process rather than after numerous failures.
I mean, that's a philosophical position that I definitely take. That's how they do it in China, when all the hospitals are, to a degree, integrated. Even a Western medicine university hospital still has a Chinese medicine wing. Of course, the percentage of which it represents is much smaller than, for example, the hospitals I trained in China, which are Chinese medicine universities that have more Chinese wings than Western wings, but still they both are being used, and they have a little bit better awareness of what might be a better first choice to try. Something less invasive, less interventional could be the first choice.
And since your background is, well, you speak internationally, you educate internationally and teach internationally, and your background's obviously, you grew up in Belgium, and before moving to China and then now to the United States. Is there a cultural or idiosyncratic area that you just feel like you can really contribute to, say, here in the southern part of the United States, that you may have not seen elsewhere? Since you're living in New Orleans, you were in Portland previously, in Belgium, you have a broad spectrum of knowledge that's kind of unique.
Yeah. I mean, every country has different medical culture, right? And so, I mean, different culture, and then of course, as a byproduct of that, different medical culture. Certain countries in Europe are extremely open and very much embrace alternative and complementary medicine and modalities. Other countries, not so much, right? The Roman countries, the Latin countries like Spain and France, and they're a little bit more conservative, and it's a little harder for people to practice there. But then you go to the more Germanic countries like Switzerland, Germany, the Netherlands, they're very open, and they even have their own tradition of herbal medicine, like Western herbal medicine and homeopathy and things like that. And so it all depends on kind of where you go and how you fit in. And it's a little bit the same in the United States. I mean, I worked in Portland, Oregon at the naturopathic college there. Used to be called NCNM, like National College of Naturopathic Medicine. Now it's called NUNM, National University of Natural Medicine. You know, as they've grown, they've incorporated other programs as well. And so the culture in the Pacific Northwest, my experience was very much kind of like Germanic countries. You know, lots of people avail themselves of alternative medicine. I mean, you literally had an acupuncturist on every block, a chiropractor around every corner, and people truly all use those modalities. And so, you know, there's two acupuncture colleges in Portland, Oregon. There's a chiropractic college, a naturopathic college. We have one of the NIH, of the NCAM research centers there at OHSU. I mean, so there's a lot happening there. Coming to the South, my experience was much different. Like, there's a lot more education needed for the patient also. Like, I felt like in Oregon, the patient came very much informed. Like, they had done a lot of homework. You know, they've done extensive Google research on your background and who they want to see and why they want to see that particular practitioner for what modality. In the South here, I've experienced that people come word of mouth, you know, definitely part of the culture, but they need a little bit more education on what the medicine can offer. Like, when do you see a chiropractor versus when do you see an acupuncturist versus when could you work with an herbal medicine and so forth. And so I feel like that's a place I'm even considering doing small talks in my office here just for patients to kind of give them a little bit more awareness. And I've been doing little talks at Tulane University for their first and second year students as part of they have an elective on complementary medicine. And so, like, just small, like, awareness classes or talks, I think, while in Oregon, I never felt the need for that. But here, I feel like that's still very much necessary.
I think that's one part of the Southern Pain Society. We are multidisciplinary and interdisciplinary, and there's many ways to try to help and provide hope for the patients out there who are suffering. And so, you know, we've had from psychologists to physical therapists to nurses to every variety of physician, and that's part of the sort of the broad spectrum of pain. And the reality is, if one particular aspect works really well for pain, that we don't be doing that. And there's lots of things that help, but there's not one magic bullet out there. And I think that's why this varied approach, and especially, you know, Chinese medicine, there's multiple thousands of years of expertise and tradition that we're still trying to grasp. It's and we really thank you for you know, being able to speak at our upcoming meeting, and hopefully this will end up being a excellent education for all of us, and maybe help serve at least to educate some of the practitioners out there, and maybe some of the patients will hear about this too, and this may be the aha moment for them on what might be appropriate for them. So.
And you know, I'm very grateful for the opportunity to speak, because the majority of my conference talks are in the alternative medicine field, like, you know, and so being able to branch into the conventional medicine, it's kind of striking, because at the same time that I was receiving the invitation for your conference, I also received an invitation for the American Medical Acupuncture Association, which is an MD only acupuncture association in the United States, to speak at their conference. So I was like, wow, this kind of nice to get also some demand from the just conventional field, and being able to kind of work together a little bit.
And I actually think the demand may be out there, and there's certainly the interest. I think sometimes it's the how do you access it, and,
exactly.
And I think that's of course, COVID has not made this easier, and
that's true.
And so hopefully we can then find ways to you know, bridge these gaps which exist that we don't really need to exist, and we don't want them to exist.
Right.
So, but again, my name is again Dr. Thomas Davis, and this has been an interview with Dr. Arnuad Versluys of New Orleans, previously of Portland, as well as Beijing and Wuhan and several other. Anything else, Dr. Versluys?
No, I'm really looking forward to it. Thank you so much.